A big hello once again. Welcome to It's a Frankly Harry podcast. This is your host, Frank Weber, welcoming you once again to my studio or the forest, where there's no shortage of quote-unquote secret things to talk about. Today I'm going to talk about 2 or 3 different things that are all pretty much related, and I hope you'll bear with me. They're all pretty important to me, but I think there's a lot of humor in them as well. The first thing, though, I want to give a big shout out to Dr. Laura Brenner Studholm, who I talked to a few weeks ago on the phone. Laura is, like me, a dentist, and in fact, I think we were at Baylor concurrently for 1 year in 2000 and 2001. We were not in the same class, and I don't think we knew each other, but she practiced for a little while and had a little change of heart on dentistry, kind of like I'm going through right now and doing some other things, and established some side gigs and side hustles that became her primary jobs, like Lola B's career coaching and a blog, and we even have a Facebook support group. So I wanted to say hi out there to Dr. Laura if she's listening. Really great group to get together and talk about things. But anyway, I wanted to also, big thing I wanted to go to, because speaking of side gigs and side hustles, I got to thinking about another healthcare practitioner who you've probably seen on commercials a lot lately, the last couple of years, Dr. Shannon Klingman, who is an OBGYN. I don't know how she views her job or profession in that field, but she definitely has a big side hustle going with the Lumi and Mando full body deodorants that I wanted to comment on a little bit. This is really not a product review, but I'm just kind of giving a more congratulatory shout out and way to go in establishing something that has caught on so big that competitors and other brands that do body hygiene, like Old Spice, for instance, are now copying her product. So there's definitely a market out there, and presumably it's good. It does remind me, first of all, because we have to have a little humor in this show, some of it might not be very good. There was an old Aggie joke, and if you're not from Texas, an Aggie, of course, is someone associated with Texas A&M. The jokes are based, essentially recycled Polish jokes, right? But there was an Aggie who got into a crowded elevator one day, and he smelled something really bad and said, "Somebody must not be wearing their deodorant, and it can't be me because I don't wear any." Now, I'm sorry about that. That was a terrible joke. But when I first started seeing her commercials, I kind of thought of full-body deodorant as being sort of like a Febreze for humans. I just remember, again, we're going to talk about dental school and professional school on this show, but when we were in gross anatomy, they gave us these puke yellow lab coats to wear to keep, the stench and other crap from getting on our clothes, and so it would get on the lab coat and everything, and we would spray Febreze on it, but that would only cover the smell. Washing it seemed to work pretty well, I think, but we couldn't wash it every day, so we just sprayed Febreze on it. And that's kind of at first what I thought of her product to be. Again, I haven't used it, but it sounds like it's really good. It sounds like if you're on a date, instead of spraying high karate on your dick and balls, you can use some Mando on there instead. So thank you, Dr. Klingman, for that. If you kind of think about it, in a professional setting that she works in and I have worked in, Dr. Laura has worked in before, I mean, you can get all sorts of crap and shit on you on the course of a day, whether it's blood or spit or semen or urine or whatever the hell you're working with. But you can't always get to a shower to clean up, and you want to maintain a certain professional look and demeanor. Then Lumi full body deodorant, I guess, works in a pinch. Still not really sure how it is necessarily better than a shower, but apparently she has research suggesting that it does. I had one of my many incidents in dental school. I think some nefarious and busybody professor one day accused me of having too much body odor. And I think it was probably because I had some issue the previous weekend with the washing machine outside or something like that. Or I could have just been stressed and sweaty, which I was a lot of times over there. It drove me crazy in that school. That Lumi, or actually Mando, might have come in handy there, but then it can't really do anything for your clothes, come to think of it. So, let me see here. So, like, you can understand with having to be in these stressful environments and body fluids, and a lot of times nowadays, having to be on roller skates, seeing what seems like a million patients in order to make production, that something like this could come in a pinch at work, or, like I said, on a date, or maybe you're about to, I don't know, go to a wedding or court or something, I don't know. But anyway, I just wanted to point that out, just several observations for that product. And let me do a quick break. I'm going to come right back with this other part. So this show prides itself, I'm trying to be funny. I don't know if it always works. The full body deodorant concept should lend itself to some comedy. But again, I congratulate Dr. Shannon Klingman on her success with that. This show is supposed to also be about topics, really deep, big picture topics that we don't always talk about in this society. Things like, what kind of country do we want the United States to be going forward, especially in light of another presidential election coming up, or what to make of the American dream. I know certain groups of people are having a lot of difficulties with that right now, or it could be a very serious and very tragic topic of something like human trafficking, which the media almost never covers. And if you're a licensed professional, though, in pretty much any profession in any state, though, your state board has required you to take continuing education in Texas it's 2 years. If they require you to take additional courses, I get pissed off to begin with, even though it's for a good cause. You want to be able to recognize this. But in discussing Dr. Laura's situation and my situation, and not knowing Dr. Klingman and how she feels about being an OBGYN, I was told one time many years ago that OBGYNs, obstetricians and gynecologists, are the most sued physician specialty. At least it was, 30 years ago. I don't know if that's still the case, but and it always kind of rubbed me the wrong way, and always scratched my head and wondered what kind of world we were living in, and why humans were so mean to people who presumably have to have a big heart to go into something like that, delivering babies and actually bringing life into the world. But then they seem to get sued because people expect some kind of perfect result, and even pregnancy and childbirth has complications, and that's another whole nother topic entirely. But I just wanted to share like a couple of laments about our current healthcare system today, things that the average citizen is really not going to understand. I have two main complaints that I'm going to share today, because obviously I could go on and on and on about this. But the main problem in dentistry, and I would assume other healthcare professions, possibly many other non-healthcare professions, is that there is too many third parties involved all the way around, too many people with their hands in a cookie jar. And the main control and direction of the profession should be from those in the profession. They should be guiding it, deciding which way they want to go, not letting everybody else in, everybody else wanting a piece of the pie. So that's number one. I would tell you too, though, and this is especially true in dentistry, but I have a hunch it's probably true, like I said, as in medicine, nursing, whatever, that there is a weird devaluing of services over the years. Monetarily, it comes primarily from insurance, but there's also something in patients. I can't remember if it's psychological or something. There's a non-monetary devaluing, though, amongst patients in this country as well, which doesn't make a lot of sense to me. And in the last segment, I was just talking about the stress that physicians and dentists and everybody are under, because we're under this pressure to produce all the time. And where it comes from, it could come from several different sources, really. But if you think about it, insurance, if you contract with them, as medicine definitely has over the years, and dentistry has been a lot slower to catch up, but I think we're there now. Insurance devalues the price of a particular procedure, one that is probably below actual overhead cost. And of course, we have to raise the price a little bit in order to make a profit and pay employees. And so what happens versus the old fee-for-service system, where you could leisurely visit each and every patient, spend good time with them, addressing their concerns and treating them, in order to make the same inflation-adjusted amount of money nowadays, you now have to spend a lot less time with them, really jump from chair to chair, and see so much volume in order to make the same kind of money. And in doing so, it stresses you out. You work harder. You may develop physical and mental symptoms. I was having some issues with that as well. Sometimes the pressure for production doesn't even come from the dentist. It comes from some third party way up top, like a CEO or somebody really demanding production there. And this is not an easy job. I mean, what we do looks easy, but there's a lot of fine physical movements. A lot of twisting and turning can really hurt your back, can hurt your hands. And now that I'm a little bit older, not particularly old, according to a lot of people, late 40s, but you start having physical symptoms, and you start wondering if the production and whether patients value and appreciate it is all worth it in the end. And, God damn it, I think I'm losing my train of thought again here. Let me just pause one more time here. I think the last thing I was going to say, though, too, patients' intrinsic sense of value and whether they appreciate it or not is also a concern. It can really play with your mind. I know in dental school, we had a lot of professors and students and so forth who really messed with each other's minds and got paranoid about what was the right way of doing things and what a successful procedure or other endeavor actually looked like. And now, there are some patients out there who don't necessarily value or appreciate what we're doing for them. And so that can mess with your mind as well. I will tell you also that dentistry and other healthcare professions, they're like retail professions or other service professions. I mean, you get what you pay for. So if you go to a public health clinic or an economy place so that you can spend less money, you're going to, you may get something that's standard of care, but it's not going to be as good as something that you could definitely spend more money on. Anyway, I hope you had a few laughs, and I just wanted to share a little bit about what's on my heart today. There's a lot of stuff on my heart, and then just these. This is one of my side gigs at this podcast, and sent my first book to a few literary agents. We'll see how it goes. I'm cautiously optimistic. I think we have a good story there. I'm thinking about writing another book that's going to be a little bit different, but still entertaining. Also I think I'll give a quick shout out as well to my Aunt Joyce down there in Seguin, Texas. Hope she is recovering and gets better soon with her cancer. And I think that's about it for today. Hopefully I didn't ramble too much. I think I say that every week. Big plans for this show. Hopefully we'll have some video and maybe some guests here within the next few shows, and really make this podcast everything it needs to become. And but anyway, thank you for joining me again. Hope you enjoy your time here with me in the forest, as I call it, on It's a Frankly Hairy podcast. Be sure to hit subscribe, tell your family and friends about it. We're going some big places, and really excited to see where we go. So thank you, and until next time, take care. I love you. Bye.